Okay, moving on. What are the challenges that we face adhesively? Well, if you really sit here and think about it for a minute, there are actually quite a few. First of all, many doctors are still indoctrinating the total etch method. Some doctors are using self-etch, and other doctors are using selective etch methods. We treat a variety of dental conditions. The dentin varies. We have vital dentin, sclerotic, how much enamel is present on the tooth, all determine these types of the bonds that we're looking for. Additionally, we're also dealing with a wide variety of materials. We're not only doing direct placement, but we're doing veneers, crowns, inlays, onlays, implants, and a variety of things. Additionally, we may require a different adhesive strategy when we're faced with situations where we have retentive preparations or non-retentive preparations in the case of doing indirect restorations. And of course, we're using a wide variety of materials today as well. We're using glass ceramics. Many doctors are now using structural ceramics. Doctors are still using metals, and new to the market are these nanoceramics that are actually blended materials of fine particle ceramics embedded in resin. And of course, we have to take into consideration what type of surface treatment we'll do to these materials. Are we using light-cured materials? Are we using dual-cured? Are they self-cured? And what is the film thickness that we must employ in order for these restorations to seat? Additionally, we are using adhesions today for things such as desensitization, sealants, and repair of restorations. Many dentists have become victim to what we call mix-and-match dentistry. This is a direct result of the fact that a lot of confusion exists in the market with respect to products in the same class. For instance, what are the best properties of each, and can dentists combine products? What this typically results in is dentists doing clinical experimentation in their practice with no sure idea of what the final outcome will be. Historically, total etch has dominated the market for some time, but as you can tell, the trend is definitely going in the other direction. And best estimates today indicate that self-etching products have overtaken the market, with the total etch products declining, although a significant number of clinicians still believe that there are applications for both in practice. When we look overall at the generational attitudes that have been attached to adhesive protocols, being the first through the seventh that most dentists are now familiar with, one thing is very, very clear. The multi-bottle chemistry sets that were characterized by the fourth generation products have been the gold standard by comparison to all the previous generations before it and the ones succeeding it. The chief difference being is that the third, fourth, and fifth generations were acid etch or total etch concepts. As we move forward into the sixth and seventh generations, we have incorporated or we have removed the need for phosphoric acid etching, instead incorporating a weak acid into these products. Now, the problem with this has been, and that as most of you probably know, is that the ability to etch enamel has diminished with these sixth and seventh generation products, making it much more difficult to achieve the kind of bonds that we should be accustomed to. In a sense, if we look at how we would categorize these, we could see that the highest bond strengths have been associated with the Generation 4 products. And as we move along the path over here to the Generation 6 and 7th, the self-adhesion concept appears to have worked, requiring the least number of steps and producing the least amount of sensitivity, but at the expense of bond strength. So the statement can be made is that it's an exercise in risk tolerance in terms of efficiency, convenience, and bond strength. When we look at the adhesion strategies or principles in general, it's quite clear that the acid, the phosphoric acid, is intended to demineralize the dental surface to produce collagen that is light and fluffy for impregnation of the resin into this matrix. On the other hand, by leaving the smear layer intact using the self-etching protocol, it is often thought that this method has been the most effective in terms of reducing sensitivity because there's no risk of removing these plugs from the dentinal tubules. And actually, these products, the self-etchers, have proven actually quite effective in terms of dentinal bond strength. The problem has always been is judging dentinal surface moisture to begin with, because as the diagram here shows, dry collapsed dentin typically does not bond very well when using the total etch technique, and oftentimes produces sensitivity. Oftentimes the clinician has a great deal of difficulty even judging what moisture content should be, and judging sometimes whether the moisture content comes from saliva or the dentin itself. So in essence, there is a bit of sensitivity attached with this particular entity. And just like the picture here shows, the differences between wet and moist can oftentimes be very difficult to judge. And dry and moist can also be difficult to judge, hence inducing technique sensitivity into the technique itself. There are a variety of studies that have also shown that dentinal humidity or dentinal moisture content can affect bond strength. In this particular study, looking at a wide variety of products, you will notice that when the dentin is ranges from dry to moist to wet, you can tell quite clearly that if you make a mistake in judging the humidity level of the dentin, it's quite clear that it can have an adverse effect on the overall bond strength. And many clinicians are oftentimes surprised when they find their product sometimes doesn't quite work or produce the sensitivity-free situation that they desire. This is sometimes a direct result of misjudgment along these lines. You can also see here, when looking in this particular category of product over here, continuing further, that if you misjudge the content, the moisture content of your dentin, it's quite clear that it will affect your overall bond strengths. So what manufacturers have recommended is what we call, or what they call, a new adhesion strategy to compensate for the Gen 6 and 7 products, which do not have the effectiveness of etching enamel like the total etch concept. And what we call this is the selective etch method. Purportedly, it will reduce enamel bonds, compensating for the weak acid effect of these Generation 6 and 7 products. The problem with this technique is that it's one additional step, which is, I would suppose you would say, direct or contraindicates what the technique is supposed to achieve in the first place. And secondly, many clinicians feel that it's a very difficult method for assuring a bond to the dentin when this particular etchant has to be rinsed from the tooth. The idea being is, how do you remove the etchant and not remove some of the smear layer, which is required for the self-etch method to be effective. In essence, it induces more technique sensitivity. So the question really is here is, how much bond strength is really enough? I don't oftentimes hear this question asked very often because in essence there's not a lot of good data out there that really shows how much is actually needed. We know what the shear bond strengths of enamel to dentin are, but many of us don't realize that most of these maximum strengths are generally not achieved until 24 hours later. We also need to remember that bond strengths also degrade with time to things like dentin, with enamel bond strengths being much longer lasting. And two, a lot of the information that we get, the reliability of the data and such, oftentimes comes from literature that we could sometimes question. It may come from a friend, it could come from a colleague, it could come from a manufacturer's representative. Many of us need to really be sure that if we're going to invest our time and effort and treat our patients, we would want to treat our patients with a product that we can trust using good and reliable data. There are mitigating factors attached to how bond strengths are achieved. And it doesn't take a lot of thought to realize that dentin is a very variable condition. For instance, we deal with sclerotic dentin, we deal with dentin on aged patients, we deal with reparative dentin. All these kinds of things necessitate the thought that high bond strengths should be our ultimate goal, because it makes sense to say the higher we start out, and with the idea that bond strengths will degenerate over time to dentin, it's a good thought. Additionally, how and where we treat teeth is also important. As you can imagine, it's much easier treating teeth in a supragingival situation, but most of us have to operate either equal or subgingival in many cases. And we also know that bond strengths to enamel, and dentin, and cementum are variable as well. Poor outcomes, whether you're using indirect or direct techniques, are known. And as you might understand, that if you look at a variety of these pictures, I think all of us have seen these clinically from one time or another. White lines around restorations, brown lines around restorations, leakage around crowns, staining and discoloration, wear and gap areas where margins are exposed, and even recurrent decay. These are all evidence of bonding failures. The question is it the product or the technique? Well, the answer is most of the products are generally quite good. The real truth is that with technique sensitivity and a variety of steps or a number of steps, the higher the number of steps associated with a given technique, the more likely a dentist is to create problems for themselves. Sensitivity has also been an issue for years in terms of bonding, and doctors have always been looking for the holy grail of adhesive to address these various conditions. Doctors have oftentimes tried to use desensitizers in an effort to make up for deficiencies in technique. However, adding additional chemicals or adding additional steps can sometimes produce very variable results. In this particular study that you see here, it's quite clear that there's quite a bit of a difference, in essence an unpredictable effect on bond strengths when using desensitizers. So as a general rule, I personally do not recommend the use of them, even though doctors have experienced success with them, because of the very fact that they can have a negative effect on bond strengths, and conversely also have a positive effect. The question would be, do you know which? So, if we were to ask the question, what would be the optimal bonding agent if we were to make one for ourselves, and what would be its properties? Well, if we think about this just for a moment, there are a lot of things that come to mind, and some things which some of us may not have thought of. I would say the first thing that many of us would want is just what we've been talking about here. We would want the highest bond strengths attainable to tooth substrate. And we would also want high bond strengths to the material that we join to the tooth. Compatibility is also another issue because, as we discussed a little bit earlier, the mix and match method of putting things together can work sometimes and not work. I've always recommended for years that dentists use a product line from one manufacturer, because anything other than that constitutes clinical research in your own practice. And it's very difficult to quantitate outcomes when you're constantly switching products and mixing and matching them with one another, with manufacturers, different manufacturers. Additionally, we want materials that work well in our hands. In other words, they should be easy to dispense, not require a lot of manipulation, with the fewest steps possible. And that's quite clear. That was the objective of the Generation 6 and 7 products, because the concept was, from the manufacturer's perspective, is that if we gave dentists fewer materials to handle, fewer steps, the likelihood of a dentist creating a problem for themselves was diminished. And sensitivity being a key factor, it was oftentimes thought that if we got the steps down from, say, 6 to 5 to 4 to 3 and could achieve the same results, wouldn't that be really great? Additionally, we want materials that would respond well either to light or in a dual cure process or even cure on their own. And what we have yet to have really are materials in the adhesion arena that have been forgiving in conditions that are less than optimal, which is generally most of the time. Because we're working in dark areas of the mouth. We sometimes are dealing with patients that can be just really a chore to handle. And as we still don't have enough dentists using routine isolation, either a rubber dam or something like an isolate for adhesion, it also produces an additional challenge. But the one thing that has always been missing, and if we could always have put it into one product and say, what could we have that would optimize everything I do, it would be to have a product that would let you use it in an identical fashion regardless of the clinical need. So, to summarize and looking back over the last 25 or 26 years, most dentists by need have had to use a number of different protocols for a given technique. For instance, for direct restorations, they may use a different adhesive system. If they're placing crowns versus composites, they may use a different system. What about situations when you're doing repairs on restorations? In-the-mouth repairs on ceramics, as we know, are not easy to do. Or the occasional need to desensitize. These are challenges to be sure. And to this point, dentists have had to have a portfolio with a number of systems which has not been cost efficient, but the doctor has also been forced to spend time understanding the techniques for each, and in many cases, oftentimes causes confusion. I've been in many an operatory with a dentist, and he's had to look over his assistant and say, now, how do we use this particular product? So what we would like to say is there a new generation coming? In other words, are we now looking for a generation 8 or 9 product? Well, if we go back to the 4th generation, which was what we call the gold standard for bonding, it's quite clear that we're looking for bond strengths routinely in the neighborhood of 25 megapascals and above, because everything into the 5th, 6th, and 7th has been deficient in that regard, or at least diminished in that regard. So would the solution be generation 8, or would the solution be an entirely new class of product? Well, this is exactly what I want to talk to you about today, because with this particular product that has now just reached the market and I've had the opportunity to use, this has been perhaps, I would say this is a watershed mark perhaps in the area of adhesive dentistry, because I really can't at this point classify this as a new generation. And as I go through the data that follows this, I think you'll have an understanding why this may change everything that you do in your practice today. If we look at the history of development of this product, it goes back to the very earliest products that were very well known. In this case, the Adper Scotch Bond multi-purpose adhesive. I don't know if any of you have used this particular product, but I still have this in my inventory today for the challenging conditions that I need where I'm looking for ultimate bond strengths. A decent trade-off was a Generation 5 product, which I also have in my practice, that I use substantially to this day, which involves a total etch technique. What's different about the two, if you notice that there have been incorporation of some additional materials or chemicals into this particular product that have let it work actually quite well. I haven't been a big proponent, let me precede, I have not been a big proponent of the Generation 6 and 7 products, so this product has been very well received into the marketplace. This was the first product that incorporated MHP, which allowed for bonding using an acidic monomer to etch the dentinal surfaces, substituting for the phosphoric acid. Now we have this new product, which is the Scotch Bond Universal, that has replaced the MHP with MDP, and we shall see how it has been incorporated to be a truly universal bond agent. One of the biggest advantages of this particular product, having been a total etch aficionado for years, which I still believe is which I have believed has been the gold standard and should have been the gold standard to this point, is that this particular product will allow us to use any etching method that we choose. If you want to do total etch, go ahead and do total etch. If you want to do selective etch, there would be a reason to do this, go ahead and do it. Self-etching works just as well. And if you look at the examples for this, I would still total etch today veneers in class 5s because of the challenges associated with, or the need rather, for high bond strengths and low leakage in these areas. In the areas of selective etch, it would be more appropriate if you place inlays and onlays, where you have wear in marginal gap areas that are exposed to, say, occlusal loads, as you would with an inlay or an onlay. Self-etching, obviously, would be very desirable in a situation where sensitivity may be an issue. We don't want to etch, potentially creating more sensitivity with a phosphoric acid, and we may want to place crowns in a routine fashion or for repairs of restorations or for any practical reason that you could imagine. When you look at the results in terms of etching enamel and whether or not there has been a trade-off with traditional total etch adhesive and using a product that has been considered a gold standard product for years, such as OptiBond Solo Plus, it's quite clear here that the manufacturer has met its mark in terms of achieving very good, reliable bond strengths, even in the self-etching mode. As you notice, it's nudging up over into the 30 megapascal range. And you can notice comparatively that this product in the etch mode compares very favorably in the 40 megapascal range by comparison with the OptiBond Solo Plus. Looking at the shear bond strengths of these materials to dentin, it's also quite clear that significant progress has been made with this particular product in both the self-etch mode and the total etch mode. The bond strengths being consistently at 30 or above regardless of material used. And considering the standard, which is the AdPer Easy Bond that you see here, the self-etch, or the AdPer Single Bond Plus, total etch, which I have used for years, I am very, very impressed with the values and the data that we're getting on this particular product. Another key feature to the product, and something that I think all of us can appreciate, is there's really nothing else to put out in your counter other than the bottle. This bottle has a very unique design with a nozzle that I also like, allowing for the correct titration or precise dispensing of 1 drop or 2 drops, however you choose. No agitation is required. You don't have to shake the bottle. It does not have to be refrigerated, and it can be operated in one hand. So simply, you can hold it in one hand. You could press, click the top over, turn it over, dispense the drop, and click it closed, and you're absolutely ready to go. This product does not require mixing. So let's talk about the composition of this product, and let's see what's actually in it to get a better understanding of why this product works, as we shall demonstrate further in the program. If you notice, the key components of this particular product is what you see over here on the left. And it now looks as though that they have incorporated really all of the materials that we would use for a variety of the techniques we would choose into the product. And I have to tell you, I really don't know how they did it, because silane, for instance, is a very volatile compound. And keeping this particular material in an active state for 2 years without refrigeration was not something that was easy to do. MDP has replaced MHP, and the advantage of this is that it is a known zirconia primer. Now, for those of you who are doing your lava crowns, for those of you who are doing alumina crowns, Procera, that type of things, doctors have had oftentimes the need to bond these particular crowns because they sometimes mistake the fact that the preparation for these crowns is actually more like a metal preparation than it is for a ceramic preparation. In other words, if you're compromised in terms of retention or resistance, you would certainly want to bond this. So the addition to MTP has absolutely contributed to this end. Additionally, the addition of this product has allowed for this particular product, Scotch-bound Universal, to have a long shelf life. And when we look at exactly how it performs, it's quite clear that the bonds to lava zirconia are actually, to this point, we haven't seen these kinds of values. Because, as most of us should realize, zirconia is, for all practical purposes, difficult to bond to. It cannot be etched. Because it cannot be etched, there can be no micromechanical retention. So we need some type of chemical interface to assure a secure seal. And when we compare it with Z Prime Plus, which has been one of the industry standards that have been out there known to have bonded or produce a bonding interface to zirconia, it's quite clear that it has performed quite well according to the data that we've achieved here. As a matter of fact, it's actually exceeded the values provided by Z Prime Plus. And even more interesting is the fact that not only bonding to zirconia, but bonding to metal, whether it be a base metal alloy or a noble metal alloy. In this particular study produced by Dr. John Burgess at the University of Alabama, John told me he was absolutely shocked that this material would bond to a noble metal. Up until this point in time, that was something that we really could not do. Bonding to non-noble metals or base metal alloys has been known, but the ability to bond to both with equally good values to this point has been unachievable. So this has been a very, very impressive result with Scotch-bound Universal. The dimethyl acrylate resins incorporated into the material provide essentially a very highly cross-linked cured film. And with a high level of conversion, it can assure us a very tight seal. Also, the incorporation of HEMA is a proven monomer which enhances dentinal bonding. As some of you may be aware, HEMA is a very common ingredient in many of the desensitizers that doctors use. Purportedly, desensitizers work more for the rewetting effect that they have on dentin than they do for any of the disinfection that dentists sometimes typically associate with these things. Another particular impressive achievement was the incorporation of Vitribond copolymer, which has also been present in the previous version or the current version of the self-etching product by 3M. What we have here, in essence, is a material that has a known affinity for dentin. And it also allows for a wide variety of moisture conditions with no adverse effect on bonds to the dentinal surface. And this particular copolymer allows the doctor quite a bit of flexibility in terms of, let's just say, misjudgment. Because not all of us can be sure at any given point in time that dentin is has the right sheen to it, if you will, that we would like to bond to. And this particular the incorporation of this has allowed these self-etching products to work in that particular fashion. Now this one interests me because silane, as most of us know, is a very volatile compound. And I do quite a bit of bonded ceramics in my practice. And every one of these restorations, and I'm talking about the non-structural ceramics, I'm talking about the feldspathic ceramics, I'm talking about the lithium disilicate materials, I'm talking about the lucite materials. All these materials require etching in the application of silane. Silane is a very difficult material to handle, A, because it's volatile, 2, because when exposed to air, it loses its efficacy very quickly. 3, because it just runs everywhere. And 4, it's simply another product that you have to keep on hand. The silane has been incorporated into this and has been made stable. I've been working with this material now for a number of months, and I've been impressed by the fact how I can dispense a drop and actually treat the restoration of the tooth at the same time with very, very good results. So if you're doing any bonded ceramics, this is a bonus to you. And when we look at the overall results in terms of the adhesion of this, the use of Scotch Bond Universal in adhesion to etchable glass, it's quite clear that with the feldspathic materials, in this case it would be for a chairside dentist using Vita Mark II, or it could be for a laboratory dentist using Emax CAD, which is oftentimes known as the Blue Box, or if you're using pressed glass, or you're using the chairside version of Empress, you're going to get excellent results with this, and actually higher values than we've been able to achieve using silane alone. Ethanol and water. Well, ethanol is simply stated a much more predictable product to use than acetone. It's much more forgiving of water content in the tooth because, in essence, it's a derivative of water. And incorporating water, which is a natural solvent, makes this a much more forgiving technique. Another impressive factor is that the film thickness of this is less than 10 microns, averaging somewhere between 7 and 8. Low film thickness, if you place a lot of indirect restorations, if you're a chairside dentist, for instance, and you place a lot of direct restoration using a chairside system, it's imperative that you have low film thickness because anything that's too thick, once cured, will allow or will disallow the restoration from any time seating. And the greater the thickness, the lower the strength of the bond. So this is a very, very good product. Having a high filler weight is also desirable in increasing the bond strength. And then, of course, we have the initiators in the system itself, and it's compatible with all light sources. And when we look at the overall bonds to etch, moist, and dry dentin, it's quite clear that we have, again, very, very good results. When you look at the self-etch, etch moist, and etch dry, and you compare them with products such as Clearfill, OptiBond Solo Plus, whether etch moist or etch dry, there is absolutely no difference in the adhesion performance regardless of mode of application with Scotch Bond Universal Adhesive. You're looking at cut enamel bond strengths, whether etched or unetched, again, we have very impressive values exceeding 25 megapascals. And when comparing again to an industry standard, which is the OptiBond Solo Plus, it's quite clear that we have a successful product. Utensil bond strengths, and this is a very, very important one to me because I deal with a lot of, like all of us do, we do a lot of restorations that are in cervical areas, whether direct or indirect. And we want absolutely good bonds to prevent leakage in these areas. And this is something that's really impressed me because typically I've seen values that are much lower than this for most of the products that we've studied. We're seeing bond strengths in this area that are identical with respect to whether we're dealing with dentin or whether we're dealing with enamel. Thermocycles, by the way, is the number of times something has been processed. So it simulates what you might find in the mouth. That's a very common question that we get. So if something's thermocycled, it's an in vitro test to simulate in vivo conditions. And again, looking at the microtensile bond strengths of etched to unetched, and it's also very obvious that we've got a winner on our hands here when we looked at every one of these values is hitting the 40 megapascal mark. And when looking at images of how this applies and how the resin tags actually apply to the dentin, you can see quite clearly that on the left side we have etched and on the right side we have unetched dentin. that we have very, very good formation of resin tags with a very clear formation of a hybrid resin layer at the dentinal interface. If you use core buildup materials in your practice, core buildup materials have often been the bane of us, particularly when choosing an adhesive system, particularly for those in the self-curing mode, which will not bond to certain products. You now have available with Scotch-bound Universal a product that will let you bond to any type of core material that you have in your practice. You can see if you're a Luxacore user, Core X or Core Paste, these are very, very popular materials. By the addition of a drop of the Scotch-bound Universal DCA, which will activate and enhance the bond to those particular types of products. Additionally, if you place bonded ceramics in your practice, many of us, and this is really kind of a unique slide here because in the past, very few manufacturers would ever show data with the use of another manufacturer's product. And as an example, for years I have been an aficionado of VariLink, not like it for a variety of reasons. And looking at the data here and also looking at a number of other products that I've used over the years, I've used RelyX Arc. If you place restorations in an indirect fashion, inlays, onlays, ceramics, veneers, these types of things, it sure is very nice to know that these material, the Scotch-bound Universal, will work with these particular materials. And as you look across the board, whether you're using bonding to enamel or dentin, you get very, very consistent results. I hate putting this slide up here, but it's worth noting that, as a matter of fact, it's one of the first tests I've seen on saliva contamination tolerance. And this was done by the manufacturer 3M. They'd actually tested the product in the presence of some light saliva contamination. Now, I know there's no one out there in this audience that ever has that happen to them, but in the event that you should have that happen, I suppose it would be nice to know that the product is effective enough in terms of being tolerant of some slight level of saliva contamination, still being able to achieve very, very good bond strengths. If you like desensitization, here's a nice slide for you over here exactly to show you how easy this material is to apply. And I've been using it for desensitization. It's about the easiest thing I could ever imagine to use. It's one drop, you put it on there, and as you can see, very good resin tag formation and very good seal of peritubular dentin. Also, we've done sealants. I have children in my practice, and the ability to do these things without an acid etch an additional step. Dye studies have been done on these things, and actually the results are very, very impressive, the easiest thing in the world to use. So I would say that if you're going to etch or no etch, and I get this question a lot, I still total etch for those particular restorations, adhesive luting with enamel margins, restorations that still have all enamel in them, and veneers. For everything else, this product in the self-etch mode works great. However, it will work for everything that you see above. These are simply recommendations. So, with these types of things, if you're using RelyX Ultimate in your practice and you want to do pre-treatment information, if you're going to, for instance, do a indirect restoration, you would take the material, etch the glass, apply the hydrofluoric acid and the Scotch-bound, rinse and dry, and apply the Scotch-bound Universal adhesive to it. If you're using zirconia in your practice and alumina ceramics, light sandblasting, dry, and apply the Scotch-bound Universal adhesive. If you're using resin nanoceramics like Lava Ultimate, same thing would apply, and apply the Scotch-bound Universal adhesive. What you will notice is that other than what the manufacturer recommends for the treatment of the physical surface itself, the application of the Scotch-bound Universal is a universal approach. You apply. So, if we're going to apply to treat a tooth, this is a very simple procedure itself. You could either apply the phosphoric acid to the enamel or to the dentin surface for 15 seconds, rinse and blot dry, just as you would in a total etch technique. If using self-etch, simply do not apply the etchant. You want to take this material, apply it once, and then you should apply it again and rub it in and leave it rest for 20 seconds, and the surface should appear glossy. You should lightly dry for 5 seconds until the solvent evaporates and the material no longer moves along the surface. Light cure it for 10 seconds and you're good to go. If you're placing direct restorations in your office using the CEREC or E4D technique, as I mentioned earlier, we're going to do this simply the same way. Simply follow the manufacturer's instruction for the material. You would etch the ceramic with hydrofluoric acid for anywhere from 45 seconds to a minute, air dry. And then what you would do is simply apply your Scotch-bound universal, let it react for 20 seconds, dry for 5 seconds, just as you would the tooth. As you can tell, you do the same thing to the restoration that you do to the tooth. Nothing varies. Now, if you're going to place the restoration using something other than 3M's new material, which I'll describe here briefly, Reliax Ultimate, you'll need to use their dual cure activator. 1 drop applied to the dispense drop of the Scotch-bound universal, mix together and apply. This now will let you use the material of your choice if it's something other than the Reliax Ultimate. In this particular case here, this is an inlay case done with the Lava Ultimate nano ceramic using Scotch-bound universal adhesive and Reliax Ultimate cement, replacing 2 amalgam restorations using the selective etch technique and the finished restorations that you see on your right. The Reliax Ultimate Adhesive Resin Cement is a product that will be new, and it's already been developed. I've been using it in my practice quite successfully, and will be available to the general public in March of 2012. I have to tell you, this is a superb product. It has a very nice consistency. It does not resist, it does not prevent seeing of the restoration. It also comes with tri-end paste, which I have not used to this point, but the fluorescence with this material is very, very good. And given the fact that it does not require the use of a dual cure activator, using this product will eliminate that simple step for you. It is optimized, in other words, for the particular Scotch-bound universal adhesive. Again, another key point is if you're placing veneers, it's important to note that there are no aromatic amines, which would potentially lead to the discoloration of the veneer over time, owing to the fact that those with amines present will eventually yellow, changing the aesthetic appearance of your nice veneer case. And it also has a dual cure chemistry, so it works quite well in that regard. So, in summary, what will we say about this particular product? I have used this product to repair ceramics, to close endodontic access openings, to place inlays and onlays, to bond zirconia crowns. I am now currently using this material as my crown and bridge cement as well. And what I typically do in this, if I have to do a laboratory restoration, say something like lava zirconia, we apply this before we do the temporary. We remove the temporary at the time of placement. The interface is now intact, and simply stated, all I really need is a cement in the interface to treat the surface, the intaglio of my crown, and we bond the restoration in. In truth, with this product, I believe it's even conceivable to say that you would not need a crown cement. I have not found an application that this particular adhesive would not work for. And what we also know is that doctors, as we stated earlier, are very interested in outcomes. We want the restorations to stay in place. We want the wear. We want them not to leak, but we want our patients to be happy. In a particular study that was done both in the United States and in the European Union, postoperative sensitivity, looking at a wide variety of patients, whether the doctors used self-etch or total etch, was virtually nil. And I have yet to see a study that shows these kinds of results using either one of these particular modes. So I would have to say, in closing, that I believe that at this point, I have to say I'm wowed by this particular product. It's become my product of choice, and I'm just trying to go through inventory now because I have a variety of things still in my practice, but frankly, I've gotten rid of the silane in my practice. I just don't see a need for this anymore because everything I do and everything that we will do in the future going forward, most of it's going to be adhesive bonding. I think you've got a real winner here, and I think that 3M has really created a new classification. I think this is one bottle adhesive with unlimited possibilities. Are there any questions? Okay, let me see here. I thought, let's see. Selective etch. Selective etch does not remove the smear layer of the dent. The question is, I thought you said selective etch removes the smear layer of the dent. No, total etch removes the smear layer. Selective etch leaves it in place. That is the stated mechanism of action for it. It's available in the Philippines. I can't answer that question overseas. It is available here in North America at this point in time. So for that particular answer, I can't give. Well, thank you for the kind remarks. I got a little nervous there on this presentation because my sound wasn't working. So I thought that was, I hope it was understandable for everybody. There's a lot of material to cover. All right. Yes, you can use it on silyarene-based materials. There is no problem at all. The question is, can I use it on P90 composite resin? The answer is absolutely. We have another question here. Let me come down here. So if you do veneers, cores, inlays, and onlays, you have to buy an additional product? The answer is no. The one thing that may have confused you a little bit is I tend to use the total etch technique for veneers. Cores require an additional product. I understand what you're asking me now. You would need the dual cure activator, which is a complementary product, which comes, I don't know if you can buy this as a kit, but you would buy the dual cure activator as a separate if the material was incompatible with a, say, a self-curing composite core buildup material. Let me take another question here. Question. So you're still using etch for enamel. So how is this better in selective etch? I'm a belt and suspenders sort of guy. You get marginally better results on enamel with etching. The reason selective etching has been a problem for dentists is because dentists can't, let's just put it this way, it's very difficult to put etchant on enamel and expect that you can rinse it off and not get anything on the dentin. Enamel bonds are the best bonds that you'll ever get. And I do a lot of inlays and onlays in my practice in areas where we have exposed margins, and I still believe in etching those particular areas, but not at the risk of defeating the efforts of a self-etcher. Keep in mind, I've used total etch in my practice for years. This is the first time I've gone to this, and I've been very, very happy with it. Let me see what other questions we have here. I'm going in the wrong direction. Yeah, I'd like to make that clear. I still prefer total etch for enamel than I do self-etch to dentin. However, you're not going to lose much in the process. Remember, it's an exercise in risk tolerance in terms of the trade-off between efficiency and whatever. To me, the extra 10 seconds, knowing now that I'm not going to produce a sensitivity issue by getting etchant on the dentin using a self-etcher, makes the point moot. go ahead and you can choose your technique with no loss of result. You mean you use this universal as a cement? No. If you're going to cement restorations with this, in other words, if you want to cement a crown, this is your adhesive interface. This is what you'll treat the intaglio of your restoration with, and this is what you'll treat the surface of the tooth with. Then choose a luting agent of choice. There was a slide in here that I had that was used with Multilink, Variolink, Calibra, Nexus, those types of products. As I see it today, I use Unisem 2 sometimes as cement crowns. You can conceivably say that you could use this as a replacement for that, using that technique and getting a higher bond strength that you would typically get with a self-adhesive resin cement. And that is that category product, which is something like Unisem, Reliax Unisem 2. Okay, HEMA. HEMA is something that is a disinfectant, and I mentioned that it acts more as a rewetting agent than it does as a disinfectant. Doctors have the feeling that disinfection reduces sensitivity. However, I cannot find one clinical study that has shown that eliminating bacteria from teeth reduces sensitivity. After all, I've been in practice for 30 years and placed amalgams for many years, and most of us have never disinfected anything to no ill effects of the tooth. In theory, it sounds like a very, very good thing to do to disinfect, but if you believe you need to have that, don't use disinfectants. This product is already in it. I have a question here. What are the steps to bond to existing enamel? You could use this totally without phosphoric acid. I would still use, if you have a solid rim of enamel around the entire tooth, I would still tend to total etch. Keeping in mind, you're going to gain some bond strength, you're going to gain some reliability of seal, but you're not going to compromise anything if you choose not to use the phosphoric acid. You're going to get very equivalent results. I have a question here. Can this adhesive affect zirconia strength? The answer is no. Zirconia itself was designed for doctors who don't want to bond because it's so rigid and strong that it can be cemented. However, when you need seal or retention, which is desirable, that is something that a cement can't give you that only good margins can. It's a belt and suspenders approach. I choose the bond. That concludes this presentation. I thank all of you for your attendance. I hope I wasn't too quick or overbearing, and I wish you the absolute best. Thank you very much.